Hello everybody and welcome back to my channel. Today I will be talking about the different options that are available for correcting a prescription. So if you'd like to learn more about this, then please stay tuned. You've been for an eye test, your optician tells you that you need a pair of either spectacles or contact lenses to correct your refractive error, as it's called, to try and help you to see as clearly as possible. What are your options? So I'm going to keep this as basic as possible and go over the core options that the majority of patients will go for in terms of trying to correct their prescription. In terms of glasses, firstly and foremostly, the typical standard way of correcting a refractive error is having a pair of single vision glasses, and that simply means that the glasses are fixed to a certain power, and that enables individuals to see clearly. This will either be at distance or it will be for close-up work such as reading. You can also get single vision glasses that are specifically made for a certain set distance, such as computer work. So single vision lenses tend to be the cheapest option, the most basic option, and depending on the type of lenses that you choose, for example, if your prescription is slightly on the higher side, the cost will vary accordingly. In terms of other options, some patients at a certain point in life, if they require both distance glasses and reading glasses, will then have the option of pursuing multifocal lenses. Multifocal lenses can come in two main flavors, and those are bifocal lenses. Bifocal lenses have a marking that's usually visible, and that marking will involve either a circular element or a line, which can be in a specific portion of the glass or plastic lenses, or it can involve a line across the entirety of the lens itself. Bifocals have two specific focuses, so they have a focus for the distance, and then when one looks down beneath the line in the region of the close-up lens within the main lens, that will enable an individual to read and perform close tasks. So you have single vision, you then have bifocals. The other type of multifocal lens that is available, which is very popular in today's fast-paced society, are varifocals. Varifocals are invisible to the naked eye. They do have markings on them, but only a trained eye will be able to identify these. But essentially, varifocals have three focus ranges incorporated within the glasses that will help you to see clearly at three different distances. So that involves seeing clearly into the distance, involves seeing clearly for close-up tasks such as reading, and then also seeing clearly at sort of intermediate computer range related distances. In terms of varifocals, the benefits are that they're invisible, so you don't have a line or a circular component on them. They are a lot more convenient because they offer you the intermediate range of vision. And the other benefit of them is there are a lot more varifocal designs available in 2022, obviously cost dependent, that can afford you a very good range within the varifocal lens itself to allow you to see as clearly as possible and with wide ranges to again afford you the largest fields of view. So what I mean by that is, if you look on screen now, some varifocals have narrow fields within which you will be able to see clearly, and this is just as a byproduct of how the lenses are made. Other lenses, more premium lenses, will widen the field and portion through which you can see clearly, and that is obviously advantageous because it means you will have to move your head less in order to see more clearly, because if you have a very narrow range through which to see, your head will have to move a lot more in order to align your eyes into the correct position. So that's another benefit. Other lenses, glasses wise, that are available are specialist occupational lenses, and these lenses are specifically tailored to individual set needs and requirements. So classically, patients who only require glasses primarily for computer related tasks will find these to be of great benefit. If patients want to pursue glasses, that's fantastic, but also the option of wearing contact lenses is available. So some patients may choose to go into contact lenses first and have a pair of backup spectacles which they will wear part-time. Some patients will pursue spectacles for some time and then pursue contact lenses at later intervals. Contact lenses have also changed dramatically over the past decade, and in addition to contact lenses for fixed distances, similar to spectacles, contact lenses primarily for the distance or for reading, contact lenses are now also available as multifocal lenses to try and help you to see clearly at different distances. In terms of contact lenses, they obviously have several benefits. Lots of patients tend to wear them for sport and activities. In addition to this, it provides one with a different aesthetic look generally. They can be fantastic on a rainy day, for example, and all of the spectacle glasses wearers out there will appreciate the frustration of having wet glasses to constantly wipe during wet periods and rainy days. So the options that are available to patients are vast, and essentially having an appointment with an eye care practitioner is important because through listening to your needs in terms of your leisure activities, your work related activities, etc., the options available to you can be discussed, and then a joint decision can be made in terms of what is appropriate for you and what will afford you the best possible vision in multiple different facets of your life. Ordering contact lenses online is a very dangerous practice and should not be engaged in, because the fit of the contact lenses on the eye can vary from eye to eye, from model to model, from brand to brand. In addition to this, the safety principles around contact lenses need to be taught to patients meticulously because of the risk of infection if contact lens wear is not practiced appropriately, and the risk of contact lens related infections can be sight threatening, hence the importance. Another option that is also available to patients in terms of correcting a refractive error is things such as refractive laser surgery, and also depending on the patient's age, sometimes you can have a procedure that's called clear lens extraction performed early on in one's life. And essentially clear lens extraction is like it is a cataract operation for all intents and purposes. So what I mean by that is, when you develop a cataract, the cloudy lens that sits within your eye is removed, a new lens is inserted, and that new lens has a certain power to help you to see well. And depending on how your vision will be corrected, usually most patients are left needing no glasses to help them to see clearly in the distance, but needing glasses for reading. So a clear lens extraction, for example, is sometimes an option that patients who are in their early 40s decide to go for. And essentially what that means is they'll have the same operation to remove the lens within their eye, but they may have a minimal or no cataract at all, and essentially the new lens implants that are put into the eye will correct their prescription. So the benefit of this is they have the glasses free option, particularly for the distance, if that's what is chosen, before they develop a cataract, and then they won't go on to develop a cataract in the future. So this video is primarily about the glasses and contact lenses options, but maybe I'll make another video about laser refractive surgery options and clear lens extraction. But I thought it would be important to mention it here because otherwise this video would be slightly incomplete. Thank you so much for watching this video about different options to correct refractive errors. If you've liked this video, then please click the like button, the subscribe button and the bell icon. Until next time, thank you so much.